Hello, good day. Welcome to Lab Talk on May 18th. Today, we will talk about best practices for pipetting ergonomics. So everyone in the lab pretty much ubiquitously uses pipetting as a practice, a technique to help them complete their work. So we want to make sure that you're doing it in an as safe way as possible to reduce repetitive strain and make sure that you are accurate and healthy as you go. So we have a special guest today. His name is Mike Montanez. He is our commercial manager for the liquid handling portfolio here in the Americas. And he will be walking us through a short tutorial, so about 20-30 minutes on pipetting ergonomics. Without further ado, I'd like to welcome Mike Montanez. Mike, please take it away and help us pipette in a healthier way.
Thanks, Angela. Thanks for the introduction. So, yeah, as Angela mentioned, my name is Mike Montanez. I'm commercial manager for Liquid Handling Solutions product with Thermo Fisher. And today we're going to go over a really quick, brief seminar talking about pipetting best practices. As Angela mentioned, you can find pipettes in every lab, all over the place, upstream, downstream. Liquid handling transfers used everywhere. So we'll go through some slides. We're going to do some hands-on demonstration with the help of the immersive lab. Answer a few questions, and we'll have a good time. All right, let's jump into it. All right, so what is ergonomics? So let's talk about what the definition of ergonomics is. So ergonomics is a science of fitting the job to the worker. Pretty easy, right? That's a textbook definition of OSHA. And so, like, how is that linked to pipetting? So pipetting is something that's easy to do, on the surface. Many of us do this every single day in the lab. At first glance, pipetting can seem that it does not require too much effort. However, it does require a lot of effort, and there's a lot of plunger force that's not really realized to doing this repetitively every day and day in, out, day out. And you look at that and you say, how's it linked to safety? Well, pipetting ergonomics are very closely linked. There are many risk factors in pipetting that can cause injuries. These injuries could lead to missing time at work. And, let's be honest, nobody wants to miss time at work. That's include yourself, your coworkers. And let's get into exploring some of these links and some things you can do to help mitigate those risks. All right. So what happens if you overlook ergonomics, right? There's a lot of things that can happen. So most often people will develop musculoskeletal disorders, and that could be injuries linked to muscles, nerves, tendons, ligaments, joints, cartilage, spinal disc, really any of the connective stuff that kind of goes around that's keeping you moving healthy and accurately. And there's a lot of risk factors. So when ergonomics is overlooked, it's possible that these situations where the environments for pipetting is not properly set up can cause these problems, right? So a lot of repetitive motion is bad for the musculoskeletal system. So while pipetting in the lab, we're using a lot of force in our tendons, right? Joints and hands, especially in our wrists and fingers. And especially if you're doing this for long periods of time, a lot of these repetitive tasks that may seem easy, but with bad posture, or possibly if you're sitting, going back and forth, reaching for items, there's a lot of things that can go wrong. So you have a lot of samples to get through. You might see folks that tend to slouch, like in an awkward position. A lot of these things can play into the injury. Think about a technician that could be at the bench for 8 hours a day, like I just mentioned. It can be very repetitive, and over time, it might seem very minimal. However, they can go and kind of get further and further worse as you kind of go along. So there are three main stages when you're looking at these risks. First is stage one, and it might start out kind of slow. Okay. You might feel a little pain and discomfort during these stages. There's no real reduction in your productivity. And honestly, it's pretty reversible, some of the damage that you've done. For example, if you're sitting at the bench, you may notice your wrist doesn't feel great, or maybe your hand is starting to cramp up a little bit. Now, if that's the case, take a few minutes, take a break, walk away, 5-minute break or so, then come back and, go back at your work just to help give your muscles and joints a little bit of relief during that stage. Now, if things aren't fixed and you're not addressing some of these issues, you can go on to stage two. And here, the symptoms will start a little earlier than before. At first, you start feeling discomfort. You may be able to get through an hour or so of pipetting, no problem. No injuries, no discomfort. But as time goes on, you'll do a lot of these things over and over and over again. And, originally you could do pipetting for maybe 40 minutes at a time. And you might see a reduction in how long you can actually go into session before you're starting to feel extreme pain, discomfort in your wrist or fingers while pipetting. This is really where you start to see the kind of reduction in productivity because you need to take longer and longer breaks during these times because the pain is more intolerable. Yeah, as additionally, as we mentioned before, the pain will start a little earlier in the cycle. That's another sign you might be moving into stage 2 to a repetitive strain injury. So if symptoms persist after work, you might find yourself noticing pain driving home, cooking, doing everyday mundane tasks. And that's something to keep in mind of, right? Any activities that's causing more stress on those muscles outside of pipetting in a normal day-to-day setting, if they don't go untreated or corrected, you could go and move on to stage 3. So stage 3 is where you're going to start having pain even during rest, right? Or even when you're not using those muscles, nerves, and tendons. You're probably going to still feel some discomfort there. Often people are unable to perform their duties and everyday tasks, and this pain may be even permanent. If you get to this point, it could be a possibility that surgery might be the only way to fix it. You might find some folks wearing splints or even braces. This might help, but once you kind of let things get this far, you're really dealing with some serious issues that need to be addressed. We want that to happen. We want to make sure we kind of tackle this early and make sure things don't progress on to stage 3. There's a lot of issues that could happen. Pipetting is a forceful activity. And if you think about it, the use of force of attaching tips and injection tips over and over and over again are very repetitive and might seem very mundane and easy, but they can be very strainful on your wrists and joints. There are multiple arm and hand movements during this time. You know, for example, if you're going from tubes to a plate, performing a lot of repetitive actions, combined with reaching for different areas, having inject with your thumb, your actual tip itself, those are all going to kind of weigh on there. If you're dialed all the way up to maximum volume of pipette, think about how far you have to reach for your thumb to get that plunger in. That can require more force than a typical smaller of a draw. And we even see this even more with pipettes that traditionally have like metal pistons inside. A lot of people also tend to grip the pipette a little bit too firm, which you don't really need to grip that hard. It's not really going to want to rave from you, but over time, know that the continuous grip, the continuous strain can cause tendon issues on your hands and fingers. So pipetting is a repetitive action, right? Additionally, there's a lot of repetitive things that we do every day. And if you think about it, how much time in a day you might be pipetting, multiply that over a week, then go to a month, then go to a year. We actually find that lab technicians can be pipetting for more than 500 hours a year, right? So the really main takeaway here is the force and the repetitiveness that can cause injuries, kind of related to this. May not see much, as I mentioned earlier, attaching force to pipette tip or ejecting. However, when attaching a pipette to a universal tip, it does require more force than something, for example, like our clip tip. Everyone's seen the folks kind of, double tapping your pipette on your tip to make sure it kind of stays on and make sure your tip doesn't fall off. Over time, that can cause a lot of strain and issues. So repetitive strain injuries basically are preventable, right? The CDC recommends good posture. And the good news is that, with good ergonomics and good practices, you can prevent a lot of these things through make sure you're using the right techniques, making sure you have the proper tools, the proper station kind of set up in place, even taking a few minutes to make sure your station is set up prior to jumping in is a good best practice. So now I want to jump into the lab and actually demonstrate a few of these. And they may be a little bit over extreme, but we have Megan. Hello, Megan. Thanks for joining us today. So a few things that the CDC recommends for posture is kind of seating upright. First, we want to talk about the bad. Megan's at the bench here. She's been at it all day. She could be tired. She's starting to slouch. She may walk up and grab her universal pipette and kind of working on attaching that, doing a forceful action. You can see her elbows are not in line to where it needs to be. She's hunching over, slamming the pipette tip on there repetitively to work on her pipetting. It's just not good for her personality of being angry all day long, as well as her posture of being in this place. So we want to stay away from this. What we want to look for is the proper seated position if you're going to be seating. And that's going to be lower back, kind of upright, supported by a chair if you do have a chair. In this circumstance, she's in one of our saddle stools for the 1300. Make sure your upper back and neck are upright. Your arm is also vertical and your wrists are in the same plane as your forearm in this area. It also helps too, if you're using a pipette that requires less force to attach the tip. Megan is using one of our clip tips, which requires very minimal force to make sure the tips do attach on, and she can keep this position pipetting for longer periods of time. Another thing that they do recommend is going back and forth between seating and standing. So in the standing positions, this is going to be something very similar, where Megan, if she was to do improper pipetting, she might be hunching over. And as you can see right now, she is going to have to hunch over to get in this bench. So making sure you have the proper bench height to be doing your work is also key. So don't want to be hunching and moved over that. But if you are standing working on the bench, you want to make sure that your lower back and your trunk is upright. Your upper back and neck are in a straight position. Your arm is bent at a 90-degree angle. Your forearm is parallel, and your wrist and forearm are kind of going back and forth in the same plane to make sure you're minimizing movements. And on top of that, they also recommend a few things I mentioned earlier. So Megan's been working hard really all day long. She needs to take a break. So for every 20 to 30 minutes of pipetting, you want to make sure you spend about 3 to 5 minutes taking a break and making sure that you are letting your wrist and your joints kind of get a chance to relax, stretch them out, and shake them out so we do not continue. As you can see, we've got Dr. Roberts that appeared in our previous lab talk monitoring Megan for a safety and her ergonomics to make sure she is pipetting properly. So she'll have some cliff notes for her by the end of this. But also we want to make sure that your workstation is adjusted and making sure you can get everything in one particular arm's length, right? Everything is reachable. You're not having to go very far to get your tubes that you might need, your pipettes, your tips. You're not going far to work on ejecting tips. When you can, use a shorter pipette so you're not having to reach even further. You see Megan's working on rearranging her station here currently to make sure it fits proper ergonomics as she's going through. Use a pipette that also fits comfortably in a hand. You know, that's very important to make sure. I mentioned earlier, over gripping can cause strains and issues. We want to make sure that it is comfortable for the user and technician while they're going through their processes. I mentioned you want to keep your samples in reach, which she does have a reservoir currently right there that she's pipetted into some centrifuge tubes. You want to make sure you're using a low profile waste receptacle for tips that are currently being used and ready to discard, as Megan just did right there. And if you're standing, you want to make sure you're using anti-fatigue matting. Padding is very helpful when standing long periods of time, making sure you have comfortable shoes that you're taking breaks to kind of stretch out those joints from the standing. And then when you can, you want to make sure you have a stool or chair that is adjustable to move around while you can. And I think the saddle stool can do that as well. But these are all important things to keep in mind while you're doing your work at the bench. So what are some recommendations from the CDC to improve efficiency? One is going to be minimize repetitive tasks. Make sure you use your index and trigger finger mechanisms. So something possibly like our E1s, where minimal force is using to actually eject and dispense. Buttons also really nice, low plunger force. For the tasks of mixing or aliquoting, electronic pipettes are great, which I just mentioned earlier, because it reduces a lot of repetitiveness and makes sure you're more accurate. And then how do you reduce force? You know, making sure your pipette is clean and services on a regular basis. This is also very important to make sure your pistons are lubricated, that your springs are properly maintained in that matter to make sure your pipette is working optimally. Use rack pipette tips that fit correctly and are easy to eject. So reducing on, you know, slamming down, applying a lot of force, and making sure that you're also using minimal force while pipetting in general. And there's a clip of one of our clip tips that shows how they attach on there to help minimize those forces while ejecting and attaching tips. So in summary, safety first, right? So making sure that we have a safe environment, we're making sure we're using good pipetting practices and proper techniques, making sure that we have our station nice and everything in arm reach. Please make sure we are taking breaks. Don't overlook ergonomics. Keep in mind and keep an eye out for the 3 stages of repetitive strain injuries, right? We want to make sure those don't exceed and get to where they're in an unmanageable area. And just make sure we're being really efficient and maximize what we're doing every single day. I put a QR code that will send you over to thermofisher.com ergonomics if you would like to know more. And then also, if you're curious, these are some of the areas where we did pull a lot of this information from.